And welcome to the girls. Tonight we have a fabulous show because we have something that everyone has been dealing with at some point in their life. It's the desire to fit in. Where do you fit in? You know, everybody wants to fit in either to an idea of what they have, or if you're not fitting in for some club, or from when you're a little kid even, Janine. I mean, all of the time, every time I took you to the doctor, it was you fit into this percentile or that percentile, and really everybody wants to be unique, but at some point you're forced to fit in. How do you do that?
I don't know. We're going to talk about it on today's show because we're going to talk about body image and how people perceive themselves, how other people perceive them, and it's really exciting. We have a special guest with us. We have a couple of guests with us, and later in the show we're going to meet two remarkable people. They're actually a couple who actually decided to fit into their own needs, and it's really going to be exciting to see their transformation.
Right, we're going to be able to pick up where their journey is continuing on and find out how they started and what they're going to do. But first, right now, we'd like to introduce our first guest, and many of you know him from this area. He's a very remarkable person. He's a surgeon. He does a lot of great things for the area. Dr. Michael Bono.
Thanks for having me.
Thanks for coming and being with us.
This is awesome.
We want to pick your brains a little bit. This is awesome. You're awesome.
Pick away.
Pick away.
Yes.
Okay, Doc, I guess the first thing I'd like to ask you is what a lot of people are going to ask me. What is gastric surgery? Or gastric surgery? What does that include?
Well,
that's what you do.
I'm a general and bariatric surgeon, and we do bariatric surgery in our region. And our hospital, the Greater Hazelton Health Alliance, is a center of excellence in doing bariatric surgery. And we've been doing it for over 12 years up here, and we've had a number of shows with, with
Samson Productions.
But these procedures have been around for well over 60 years, and our National Society was created in 1983, and in 1991, these procedures were deemed to be the only viable long-term weight loss for people who are morbidly obese. So what I do is morbid obese surgery.
Morbid obese surgery.
That's the dry part. Now it's just, it's the more comfortable
before
part.
Before you get to all that fun stuff, when people say, when you say I want to lose weight, people think, oh, quick fix. I'm going to go to the doctor. I'm going to get my stomach stapled, or I'm going to go get the sleeve, and I'm going to be good to go. That is
right.
False.
Wrong. Yes, you're right. It's it takes a lifetime that's incorrect. It takes a lifetime for someone to maybe get up to that weight, but sometimes there's an issue like a trauma or an injury that someone was of a better weight, and then they can't exercise like they used to, so they become 100 pounds or 100% over their ideal body weight, and then they come into my lap. And we enjoy what we do, and it's safer to do a bariatric surgery than to not do a bariatric surgery if someone is morbidly obese. Now, bariatric, everyone, we didn't know about this 20 years ago, and bariatric, it gets attached onto a surgical aspect, but bariatric means weight medicine. It's a Greek word. Baros and iatra means weight medicine. Bariatric also means medical therapy, and we also have in our region, we have the Alliance Medical Weight Loss Management, which we just started in January, and we're having excellent success. And it is hands-on. It is dedicated to Hazelton. It is dedicated to the people of Hazelton and the Health and Wellness Center. I'm surprised. I knew it would be a success, but I didn't realize how much of a success it would be. And the medical weight loss is for anybody. So you're talking about somebody who is 10 pounds overweight or 110 pounds overweight, whether they want to do a lifelong or a few months. And it's basically a jump start and a life guide, and with a multifaceted approach to weight loss. So you have medical management, you have a dietary, you have behavioral management, you have exercise physiology, all out of the Health and Wellness Center, and people have bitten into it, and it's working.
I think this area, they've done so many studies in northeastern Pennsylvania, and it's no secret that we are an unhealthy region. And I think people are starving for information on, we see this fad diet, we see this, we see that, but really it's a lifestyle change.
We're actually dead center. How about that? And our state, if you look at the country, actually the South is the worst, and that's where it spreads out.
Fried chicken.
And Yes, but we're actually probably dead center, but we're not the best. Colorado is always the best state, so it doesn't mean if you move to Colorado you'll be a leader.
Right?
Only if you follow their lifestyle.
They're always outside, like rollerblading or skiing or something. But
So
we are actually the norm for the country about, and when you consider like our patient pool for our hospital, okay, for the Health Alliance is about 70,000, the first wave. So if you want to say that 60% of our population is not normal in theory, if you want to use that word. So 60% of 70,000, add that up, that comes out to 42, right? 42,000. 5% of the population is morbidly obese. So 5%, that's a nickel on the dollar. So 5% of 70,000 comes out to 3,500, right?
Well, I was reading somewhere where 2/3 of American people are
absolutely right.
obese.
Yes, everything. Yes, that you're smart. Everything's in thirds. A third. If you want to calculate where we are, there's different words for our weight level. So you're a normal weight or lean, you're overweight, or you're obese, or you're morbidly obese. And so you can split into thirds. And what we calculate it by is the body mass index. And everybody goes online and they can calculate. They're very educated now. We can calculate your body mass index. And the body mass index is purely your weight over your meters squared. So your kilograms over your meters squared. Because if you're 6'2" and 200 pounds versus 4'2" and 200 pounds, two different people. If you're a bodybuilder, all right, versus a couch potato, you're two different people. So a third of our population is in theory lean, normal, in theory. Then another third of our population is overweight. Another third of our population is obese. And then 5% of our population is morbidly obese. So there are, in Northeast Pennsylvania, 1.2 million Northeast Pennsylvanians in about 10 or 12 counties, however you want to count it. So that comes out to 60,000 people are morbidly obese. Okay, that's the morbid obese. We didn't go into the.
So is that who is the candidate for what surgeries you do?
It's pretty well delineated. The insurances have actually come up to bat pretty well. I have to give our country a little bit of credit, a lot of credit, and you have to be 100 pounds or 100% of your ideal body weight, and most of them follow suit. And usually, it's a body mass index. Throwing a number out is 35-ish, and that that's where you become a candidate for surgery. And you need to understand that being morbid, being obese, being overweight, each level has not only health issues but a cost issue. It's expensive to our country to be overweight.
Sure. Exactly.
$147 billion it costs our country to be overweight. And this has gone exponentially over the past 20 years. It costs employers for paid insurance. If you're an employer and you have to pay for insurance, and this is coming into focus now, and you have the same resume, the same nice smile, the same recommendations, who are you going to pick if someone is morbidly obese and someone is lean? If you have to pay for the insurance.
We're going to stop you right there, and we're going to take a break, because when we come back, we're going to meet two amazing people who chose to get healthy. They visited Dr. Bono and they had a procedure, and you're going to meet them when we come right back. Stay with us.
Today's episode of The Girls was taped in front of a live audience at Mia's. Once again, the Hazleton area's #1 rated restaurant. Since 2008, Mia's has been the area's top destination for fabulous food, full-service bar, and all types of luncheon and dinner party needs. Call Mia's at 570-501-3410. And remember, tonight, make it Mia's.
And welcome back to The Girls. We're talking about body image and fitting in, and today we have a lot of guests with us. We have Dr. Bono, and we talked about different procedures that you do, and we have two of your patients with us today that actually found success with what you provided them. So thank you for joining us, both of you.
Thank you.
Thank you for
This
having us.
is Kim and Jeremy Artmont.
Yes.
And thank you again for joining us. May I ask you one question that has been on my mind since I met you?
Okay.
What was the driving force that actually made you say, today's the day, I'm going to make the call, and Who called first? Who called doctor? I know you're a husband and wife who've gone to doctor for the surgery, but who took
I
the
love
step?
my husband, but I did all of the pre-op work.
I understand. It's called the girls.
We made the decision together, but yeah, I was the one on the phone with Brenda all the time.
So you had to forge the way, and you had to be the one that would show him the way.
It's easier. I have a work in an office, so it's, I have the phone right there on my desk. So.
Okay, and what made you make that call? Like, what is it about your life that you weren't happy with, or was it your health? What was it that actually had you make that call?
Just wanted to be healthy.
Wanted to be
desire
healthy. To be healthy.
Yes, and we also ride motorcycles, so that started to get a little awkward and uncomfortable and unable to ride long distances.
So you did this for yourself. It wasn't because
Absolutely.
someone else was making you feel uncomfortable, or your husband,
No, I've
or
always
how
been
you looked.
pretty confident in my own body. I mean, the way I always looked at things, if you don't like me, don't look at me. But, it was just more, I wanted to be completely healthy. We want to live a long, healthy life together. So
And you know what? That's probably the best force, because if you do want to be healthy, you're going to go to all ends to be healthy.
Absolutely.
And that's something that you're doing for yourself. So
So what exactly did you get done? What surgery did you get done?
I had the bariatric sleeve done.
Okay.
bariatric sleeve.
And what did you decide? Why did you decide as far as getting that done, as opposed to did you try different diets, just so people understand your story?
I've been on yo-yo diets probably my entire life. A few years ago, we actually joined the Y, and we were very dedicated, went all the time, didn't lose a pound. This one, it's just the whole dynamic of just my body and I guess how I eat or when I eat. And I've learned through all this entire journey so far what to eat, how to eat, how much to eat, when to actually eat, what times during the day are the best times to eat, because your body processes it a lot better. It was just very educational. Very educational. And plus our daughter is 19 years old and she is a type 1 diabetic.
Oh, so this is a great example for her. You have to watch her as well. Well, take us through the steps of it from the time that you had the surgery, and then after surgery, how difficult was it for you to eat? Were you able to just eat anything, and where are you at now?
I had my surgery on October 29th, and to this point, I can actually eat meals. Not a lot of things, but I usually eat a lot of proteins. So I will have a meat and a vegetable typically at every meal, except for maybe breakfast. Breakfast, I usually have a protein shake.
As opposed to, how did you used to eat before?
Well, before I would skip breakfast, I would have a normal lunch, I guess, but it would be more like sandwiches, French fries, bread, anything that was quick to just grab. Dinner was always a joy, because it was usually by the time I got home, I was exhausted. He'd get home, he was exhausted, and it's like, where are we ordering today? Okay. So it was usually takeout, where now we actually cook every night.
So now everything's planned more or less, so it's more conscientious eating.
Absolutely.
So Doc, what is when you do this surgery, what are you actually educating your patients about?
Oh gosh, well, everything. Yeah, there's about 80 of us plus in the state, and I like to think bariatric surgery is the last bastion of gentleman's surgery, because there's so many patients out there. We all want everyone to do well, so we all kind of do the same evaluation, and you don't go into it not knowing what you're going to get into, and there's a lot of questions you can ask. Like, what procedure for each patient? What procedures do you offer? Are you the right patient? Are you a candidate? And we offer 3 procedures in the region. So we offer the gastric bypass, which was created in 1966, and we also do the banding procedure. And the sleeve gastrectomy, it's not a tube, it's not a sock, it's not, people think here's sleeve, but all it is, it's our not newer procedure, but it's becoming the safest, most popular procedure for the same weight loss that's safer across the state, across the country.
How do you select which surgery is right for each person? Is it their preference? Is it your examination?
You used to always wonder about that. How do you pick? But just let it happen. It's like being on the girls. Just let it happen, all right? You'll see the patient will come in with an idea, and you educate educate them and say, well, this is what I'm thinking. Look at what their past is and what their lifestyle is. Some people don't like their bowels being transected. Don't want anything. Don't want half a stomach removed. Don't want a rerouting. They're like, I don't like that, and so they're the right patient. They're the right patient for a banding procedure, which is a weight loss procedure that is purely restrictive. It's a piece of plastic put in your belly that inflates and deflates and makes you feel fuller or not, makes you feel fuller and gives you satiety. Less pre-op, more post-op. You're in the office more often. So, distance is an issue and, your lifestyle at home. But some people want it that way. Some people, the bypass was the most popular. It's kind of going down in popularity. It's the right operation in the right patient. If you have bad reflux, if you're a big-time sweet eater, or depending on your insurance, some insurances point you right to it. But most are pulling away from that, or accepting it, but also accepting the sleeve gastrectomy, which is just removing the greater curvature of the stomach.
And that's what both of these
Yes.
patients have had.
And it works.
And how successful, excuse me, Jenny, but how successful have each of these surgeries been? Do you have a lot of people who maybe have a relapse that they need to
No.
come back? Or
No.
So it's been generally successful?
Yes.
I'm sorry.
You have to go,
And let's
each
play
patient.
devil's advocate, because there are people out there saying, listen, if you eat healthy and you work out and you follow these things, you're going to lose weight on your own. So why is there, and you're saying no, so what is the need and why do we need to get surgeries like this?
Well, it's hard to explain. When you're out there and about doing the exercises, you don't put all these other things like in consideration. The thin girl next to you versus somebody over there. It's very discouraging. So you end up quitting, and that's where yo-yo comes from.
Okay, so it's discouraging. Just elaborate on that. So what has the surgery
Like-
done for you as far as you felt like
Well, I
you were...
can tie my shoes now. I
And did
went
the
for a
weight come
300.
off faster, I guess, too?
Yeah, I lost 55 pounds in 3 months.
55 pounds in 3 months. Is that safe, Doc?
The weight loss path, it starts even before the surgery. And so and that's kind of a question, like when does the weight loss actually start? The day of surgery or before? It starts before, the day I meet you and you meet our team, because we start you right away with our dietitian and we start you on a healthy weight loss strategy. And and a lot of the insurances require 4 to 6 months of monitored weights in the office, and you're learning how to eat healthier and get into a better state.
So this whole program isn't just have the surgery or on your own or whatever.
No.
It's a constant
No,
from the
absolutely.
beginning, the
It's definitely a
training, the
process.
evaluation, the psychological and whatever. Well,
educational.
you two seem to be like you're on your way to losing weight, and we're going to keep monitoring you, and we'll have you back on the girls again and let everybody out there see and hear your story of when you do get to your final goal. We'll keep in touch with Doc. Thank you so much for sharing your story with us. When we come back, don't touch that dial, because we're going to have a man with us, Dr. Robert Kimmel, who's a noted plastic and reconstructive surgeon, and you know him from Body Beautiful. He's going to be here sharing some other body image secrets with you.
Today's episode of The Girls was taped in front of a live audience at Mia's. Once again, the Hazleton area's #1 rated restaurant. Since 2008, Mia's has been the area's top destination for fabulous food, full-service bar, and all types of luncheon and dinner party needs. Call Mia's at 570-501-3410. And remember, tonight, make it Mia's.
Welcome back to The Girls. Today we're talking about body image and how people try to fit in, whether it's fitting in the jeans or fitting in your own brain, what you're envisioning in that brain. And of course, we can't have the show without having a very important part of that image, Dr. Robert Kimmel. Dr. Kimmel is a noted plastic and reconstructive surgeon, try saying that 3 times fast, and he is also a star of his own show here on Samson Productions, Body Image, which I co-host with you, so you're no stranger to me. You have a lot of great things to offer out there. Thank you for joining us here.
Well, absolutely. It's a pleasure to be on the show once again, Deb and Janine. Always a pleasure, and it's nice to work outside of the box of our Body Beautiful show that we've been airing over the last 7 months now.
Right, and we've been having a lot of great results from that. We've had a lot of people that have tapped into your genius and have been able to become what they envision, as you say.
Well, thank you. That's nice to hear.
Well, we just had Dr. Bono on with 2 of his patients, and we've had them go down a journey that they've had, and a lot of times you might work hand in hand with Dr. Bono in a certain way with people who might have any kind of bariatric surgery. If there's an enormous weight loss or I don't know how many pounds it has to be before your body can't handle, even with working out. The excess skin that's left after your body has been at a larger frame and then maybe comes down, you might have some issues with your body image even after you've attained your goal. So where do you come in with that?
Well, first of all, I had the opportunity to view the segment that you just filmed with Dr. Bono, so a lot of very excellent insights and information that he offered. And my involvement with Dr. Bono's patients comes at a much later stage, because generally our protocol is to allow the patients that have undergone bariatric surgery with Dr. Bono to gain the full benefit from the surgery that they've just had. So generally that means waiting about a year until they've had the chance to lose as much weight as they're going to,
So
and
they
actually
adjust.
exactly, their metabolism adjusts and they actually plateau generally at a much lower weight. You asked how low. It's routine to see weight losses in excess of 100 pounds, 150 pounds, 30, 50% of their original body weight loss. But it's not only the weight loss, it's the improvement in all of the disease processes that were a byproduct of the extra weight. The type 2 diabetes is gone. The coronary artery disease is improved or gone. The hypertension is gone. Their arthritis in their knees and their hips is at least improved, if not resolved. So patients garner a variety of improvements just in addition to the improvement from the weight loss.
So it's like turning back the clock and
Oh,
regaining
absolutely.
their health and being reborn.
Absolutely, and their energy levels are through the roof because now they're functioning at an energy level and able to mobilize with carrying much less weight.
And as we saw with the couple that was on with us, they're more active. They're able to go on their motorcycles. They're able to walk more and have more energy. Like you
Right.
said, you're more active. You're walking. You're running around. You're running around with your children or your
Right.
grandchildren.
Right.
So again, you're burning more calories as you're being
Right.
more active. But everyone loves before and after pictures, and you have some with us today of people who actually had the skin removal after losing a lot of weight. So talk about those.
Sure. Well, I view this as kind of the final phase in getting to that, that image that you envision for yourself, because now you've lost the weight, you've had the lifestyle improvement. Well, now there's a lot of excess skin that's there as a result of the weight loss. So let's address that. In general, the most common area statistically that we address is the central torso or abdominal area. And that's usually the area that most people start in to kind of jumpstart that overall improvement in their body image. So what we're going to show is a few images of some different patients.
Okay.
The first patients we're going to talk about is a 35-year-old female. She had undergone a gastric bypass by Dr. Bono, had lost over 120 pounds, and was at a very stable plateau weight. And what we did for her was an abdominoplasty. And on the second plate, the patient is shown in both before and at 6 weeks post-operatively. So what you can see here is a significant improvement. The incision that she had in her upper abdomen is now on the lowermost part of her abdomen, has practically been removed, and we've basically recontoured her whole central abdomen and the front part of her flanks and the upper part of her hips.
That's just so remarkable. Doc, about how many pounds do you think you took off there of skin?
The amount of weight removal, it's not as much as you might expect. It's probably in the range of about 12 pounds.
Wow.
Yeah.
Still a lot.
Okay.
Yeah.
Well, I really think that anyone who's had a child should be able to get that tummy tuck. So let's just throw that out there.
Same patient from a lateral view, showing the improvement in contour, and from an oblique view. But keep in mind that these body contouring procedures are not only for women. We also do it in males. This is a young male, 21-year-old, had a significant hanging lower abdominal fold of skin. This is the patient 6 weeks following his procedure. I think even more dramatically, you can see from the lateral view.
Oh my
Here he
goodness.
is with elimination of that excess lax fold of skin that's the remaining byproduct from his 110-pound weight loss.
And again, we're going to emphasize that they're still doing a new lifestyle change of diet and exercise along with
Absolutely.
getting the skin removed.
And that's necessary for the maintenance, of course. But the contouring that we do not only applies to the abdomen, it also applies to other areas of the body. The arms is a common area, especially in women, that when they lose weight tends to become somewhat lax. And this is a pretty advanced situation. A 46-year-old female. She had had 150-pound weight loss as a result of her gastric bypass procedure. And here she is more than a year following the procedure compared to her preoperative photograph that's marked.
And doctor, I see here where even the incision that you made to remove all of that is still somewhat following the normal line of, say, an underarm, so it looks like it's supposed to be there.
When we design this type of procedure known as a brachioplasty, what we're trying to do is design the incision so it falls between the biceps and triceps fullness of the arm so that it's as least conspicuous as possible.
So again, you see, we only have a couple minutes left, but you see a lot of people every day. And what is some advice to you when you talk about people looking at their own body image? Is there any advice you give to women or men when they're looking at their body image and trying to change that?
It's a very personal issue, and I use mirrors quite frequently because I like patients to explain to me in their own words as they look at a mirror so we can both see the same things. What their concerns are. And then that way we can develop a treatment protocol, list their priorities, and address them, in a logical fashion.
Well, it's been a great show. I hope you learned a lot. If there's anything that we haven't discussed, you can always go to ssptv.com. You could send us questions, visit Dr. Kimmel's site, Dr. Bono's site, visit the girls' site. Just visit us. Keep watching because we always have something special for you, and hoping that you'll always fit in with the girls.